I want to answer some of the questions and deal with some of the issues that are floating around about the so-called health care reform plan. For some of us who are looking at this, it's anything but a reform. So I'm going to address some of the specific issues, and I hope it's helpful to you. One of the issues that I grappled with during 10.5 years as governor was the unbelievable challenge of trying to make Medicaid work at the state level. Most people don't know this, but Medicaid is actually a bigger, more expensive program than Medicare, and it's administered by the states. Now, supposedly it's a partnership, and it is. Federal government puts in some of the money, and states put in some of the money. But under the provisions that are being proposed, it means that states are going to have to increase eligibility to 133% of poverty. Now, what that means is that a huge new number of people are going to qualify for Medicaid that have never qualified before, and that means that states are going to have a chokingly big amount of money for which they're going to have to pay to cover these people, because under the federal mandates, they don't have the option of simply saying we're not going to do it. They have to do it. Well, let me give you an example. In my state of Arkansas alone, with 2.7 million people in the population, during my tenure as governor, we had about 700,000 plus people in the Medicaid system. In other words, we virtually were looking at 1 in 4, 25% of everybody who lived in my state who were involved in Medicaid. Now, Medicaid was supposed to be only for children and for the very, very poor. But the fact is, if you continue to expand the realm at which people qualify for Medicaid, the cost becomes increasingly difficult for the states to bear. What does that mean? In addition to the fact that your federal taxes are likely to go up in order to cover all these costs of increased health care and to cover the cost of the people who just have chosen not to buy health insurance, it hadn't even begun to discuss the fact that that's also going to hit you at the state level, and chances are your state is going to raise taxes to cover its portion of the Medicaid expansion.